Does your partner complain about your snoring? Or maybe you've been told you sound like a freight train at night. Snoring is often brushed off as a harmless annoyance, but it can be a sign of something much more serious. Maybe you wake up exhausted despite a full night's sleep, struggling to keep your eyes open during the day. You might find yourself nodding off at work, or feeling irritable and unfocused, even after what should have been a restful night. This could be more than just noisy breathing. It might be obstructive sleep apnea, or OSA, a condition that affects millions but often goes undiagnosed. Imagine your airway as a soft straw that collapses when throat muscles relax during sleep. When this happens, air can't flow freely and your breathing actually stops for brief moments, sometimes dozens or even hundreds of times each night. Your brain senses the lack of oxygen, waking you to gasp for air, often without you remembering. These interruptions shatter your sleep cycle, leaving you unrested and fatigued. Symptoms include loud snoring, dry mouth, headaches, and daytime sleepiness. You might also notice morning confusion, trouble concentrating, or mood swings. This isn't just about feeling groggy, it's a serious health concern that can impact your quality of life and long-term well-being. Each airway closure drops blood oxygen levels, straining your body and depriving your organs of the oxygen they need to function properly. Your heart and brain work overtime, increasing cardiovascular risks like high blood pressure, heart attack, and even stroke. This silent struggle can have loud consequences if ignored, affecting not just your sleep, but your overall health and relationships. Addressing it is crucial for your health. Recognizing the signs and seeking help can transform your nights and your days for the better. Who's at risk for OSA? The answer might surprise you. While some risk factors are well known, others can be hidden in plain sight. Men over 40, postmenopausal women, and those with extra neck weight are especially vulnerable. But OSA doesn't discriminate. People of all backgrounds can be affected. A neck circumference over 17 inches in men or 16 in women can significantly narrow the airway, making it harder to breathe at night and increasing the risk of sleep apnea. Lifestyle choices matter too. Smoking inflames the airway, while alcohol relaxes throat muscles, both of which can worsen OSA symptoms and make restful sleep even harder to achieve. Genetics also play a role. If you have a family history of OSA or related conditions, your risk is higher. Sometimes it runs in families without obvious warning signs. Ignoring OSA isn't wise. It puts extra stress on your heart, raising blood pressure and increasing the risk of serious cardiovascular problems like heart attack or stroke. It can also disrupt how your body processes sugar, increasing your risk for developing type 2 diabetes and making blood sugar harder to control. Lack of quality sleep affects mental health, leading to depression, anxiety, and even mood swings that impact daily life and relationships. Cognitive function suffers too. You may find yourself more forgetful, less focused, and struggling with tasks that once felt easy. Drowsiness while driving or operating machinery is not just inconvenient, it's dangerous, increasing the risk of accidents and injuries. Understanding these risks is vital for your safety and well-being. Recognizing the signs early can help you take action and protect your health. Suspect OSA? Talk to your GP, it's common and treatable. They'll ask about sleep patterns and use questionnaires like the Epworth Sleepiness Scale. A sleep study, either in a clinic or at home, provides a diagnosis. Home studies use simple sensors to monitor oxygen, breathing, and airflow. Results determine your apnea-hypopnea index, AHI, and condition severity. Diagnosis is the first step to understanding and addressing the problem. The good news is that obstructive sleep apnea, or OSA, is a highly treatable condition. With the right approach, most people can find significant relief from their symptoms and reclaim restful nights. The most effective and widely recommended treatment is continuous positive airway pressure, or CPAP. This device is often considered the gold standard for moderate to severe OSA. CPAP works by gently delivering a steady stream of pressurized air through a mask, keeping your airway open all night long. This helps prevent the breathing interruptions that disrupt your sleep and leave you feeling tired. For those with milder forms of OSA, simple lifestyle changes can make a big difference. Losing weight, quitting smoking, and getting regular exercise are all proven ways to reduce symptoms and improve sleep quality. Even something as straightforward as changing your sleep position, like sleeping on your side instead of your back, can help keep your airway open and reduce snoring or pauses in breathing. Oral appliances such as mandibular advancement devices are another option. These custom-fitted devices gently reposition your jaw and tongue, making it easier to breathe freely throughout the night. In some cases, surgery may be recommended, especially if anatomical issues like enlarged tonsils or a deviated septum are contributing to your sleep apnea. Your doctor can help you decide if this is the right path. Remember, you have options. OSA doesn't have to mean a lifetime of fatigue or frustration. With the right treatment, you can take control of your health and your sleep. From small lifestyle tweaks to advanced medical devices, there are solutions available for everyone. Your healthcare provider can help you find the best fit for your needs and preferences. Treating OSA can lead to better health, more energy, and a brighter mood. It can even strengthen your relationships and help you enjoy life to the fullest. A good night's sleep is truly within reach, so take the first step toward a healthier, happier you. If you find this helpful, then subscribe for more health tips.